Hi, my name is Kathy Snow and I'm the pharmacy manager at Katy Medical Pharmacy. I'm going to talk to you today about the best way to apply your hormone creams or your compounded creams that you get from our pharmacy. First, I want to talk about the hormone creams. And these are the creams such as progesterone or estrogen or testosterone or any combination of these. I want to talk to you first about the syringes. Some of you may have different doses each month. Some of you will receive your cream in these 1 ml syringes, and your dose may vary depending on the time of the month. So some of you will have a dose of 0.25 ml. Now this is a 1 ml syringe, so there will be 4 doses in this syringe. And I've taken a Sharpie and marked on here where the 4 doses are. So for the first dose, 0.25 ml, you will push the plunger to 0.75, and that's halfway in between 0.7 and 0.8. And then for the second dose, you'll push it out to the 0.5. And then the third dose will go to 0.25, which is halfway in between the 0.2 and the 0.3. And then the fourth dose will be all the way to the end. Now, if your dose is a half an ml, this syringe will have 2 doses. So the first dose, you'd push it out to the 0.5, and then the second dose would be all the way to the end. Okay, so to apply your cream, you want to take off the black tip, and then if you're going to apply the 0.25 ml, you will push the cream out onto your wrist to that mark halfway in between the 0.7 and the 0.8. Or if you're doing a half an ml, you'll do to the mark on the 0.5. So you put the cream on your wrist, and then you're going to rub it into your inner arm, your upper inner arm. Now you want to rub it into your fatty tissue because that's where the cream is stored in your body. So, and you don't want to put it on your hands because you might contaminate other people. So be sure to keep it on your wrist and just rub it into this fatty area under your arm. And just keep rubbing until it's completely dry. And that's to prevent contamination to people or onto your clothes. It takes about a minute to rub it. You just want to keep rubbing hard until it's completely dry. And then rub just a little bit longer just to make sure. Okay, so some of you might get your cream in a 3 or a 5 or even a 10 ml syringe. And your dose may be a half an ml or a 1 ml. And that's a little bit easier to measure. So if it's a 3 ml syringe like this one that I have, your first dose, if it's a half an ml, you'll push it out to the 2.5 and so forth. If you have any questions on these larger syringes, be sure to give us a call. Others of you may get your medicine in a pump. And this makes it really easy to measure because usually your dose is either 1 or 2 pumps. So again, you want to put it on your wrist, you put the cream on your wrist, and then you're going to rub it into the fatty area or the upper inner arm or the upper inner thigh. So you want to rotate the sites each day, do a different site. So do this arm, and then your right leg and your left leg, and just keep rotating throughout the week. So again, the hormone creams are stored in the fatty tissue of your body. So you want to make sure that you apply them where those fatty tissues are, which normally is the upper inner arm or the inner thigh. Now for men using testosterone, you don't want to put it on hairy areas. So you might want to do the upper part of the buttocks or the inner thigh if that's a non-hairy area. Again, you want to rotate your sites a little bit to make sure you get an even distribution throughout your body. Now some of you may get creams that are thyroid or metformin or cortisol cream. Those are not hormones that are stored in the fatty tissue. So you're going to apply them to your wrist and rub it wrist to wrist. And that is in a base that will be absorbed directly into your bloodstream so that you'll get immediate effects from it. So again, if it's thyroid or cortisol or metformin, you want to apply the cream to your wrist and rub it wrist to wrist. But again, you want to rub it until it's completely dry, which is about a minute. The last type of cream I want to talk about are the pain creams. Now these creams are a little bit different in that you apply them to the site that is causing the pain. And you will get it either in a pump or a syringe. So we can explain that to you more if you don't understand the dosage on the syringe or the pump. But again, you want to apply the cream directly on the site that's hurting and then rub it in. You can rub it in with your hands, but I suggest you put on a glove to rub it in so that you don't get it on your hands, because you can contaminate other people. You want to rub it into the site until it's completely dry again. And you can usually apply your pain creams 4 to 6 times a day, depending on the directions on your container. The other place you can apply your pain cream is on the dermatome, and that is an area in the spine where the nerve impulses go from the site that's actually causing the pain. And we will give you a chart and explain to you on that dermatome where to apply it exactly on your spine. So that concludes our different types of creams. If you have any questions or it's not completely clear on how you apply them, please give us a call at the pharmacy, and that phone number is on your prescription label.